Hello, everyone. Welcome to the 2021 P&A CAP Virtual Annual Conference. I'm Curt Decker, Executive Director of the National Disability Rights Network, and I'm joined today by Tom Masseau, Executive Director of Disability Rights Arkansas and President of the NDRN Board of Directors. A year ago, we gathered for our first completely virtual annual conference. Our hope this year was to once again be able to meet in person. But alas, it's not to be, at least not yet. I'm happy to say that we will be returning to in-person meetings this August, first with the fiscal managers meeting in DC, and then our training for PAB staff in September in Salt Lake City, Utah. And by next year, we will all be together again for our 2022 annual conference in the DC metro area. But we're still excited to have the opportunity to bring you another virtual conference. So many of you have told us how much you enjoyed it last year. And now, with a year of experience in designing and implementing virtual meetings and trainings, we believe it's going to be better than ever. Last year, we had over 1,700 people participating, and we're hoping for that, if not more, this year. We are offering even more training sessions this year. We're using new technology that is more accessible to more people, and we've added opportunities for more informal discussion and networking so you can get to know your fellow P&A staff from around the country. I want to extend my thanks to all our speakers, trainers, attendees, and especially the NDRN staff who have worked so hard to make this meeting a success. And lastly, I'd also like to thank our federal partners. The event would not be possible without their generous support from the Administration on Intellectual Disabilities, from the Rehabilitation Services Administration, from SAMHSA, Substance Abuse, Mental Health and Service Administration, and the Social Security Administration. Please take the full opportunity to utilize our apps, the networking sessions, and all of these great training opportunities. And now I'm turning it over to Tom Masseau from Arkansas. Tom?
Thank you, Curt, and hello from Little Rock, Arkansas, everyone. On behalf of the NDRN Board of Directors, I'd like to welcome you to the 2021 P&A CAP Virtual Annual Conference. I would also like to extend my thanks to all the NDRN staff who helped to bring this virtual conference to you over the next 3 weeks. The theme of today's opening session is Leaving No One Behind, Advocacy During COVID. When the pandemic began in March 2020, as a P&A Executive Director, I thought, we can manage this. We'll just work from home for a few weeks, make a few adjustments to how we handle in-person meetings, modify our monitoring activities, and then things will get back to normal. Little did I know how much the pandemic would impact everything we do as P&As. Not only did we have to figure out how to continue the vigorous advocacy efforts we're usually engaged in, but we had to address the disparities that arose in the way that governments and the medical community developed their pandemic response. Almost immediately, people with disabilities were once again left out, and in the worst situations, left out purposefully. Their lives were deemed not worthy saving. Of course, this was unacceptable, and the P&As swung into action, filing more than 45 civil rights complaints and lawsuits to ensure that people with disabilities were able to access life-saving treatment. Over the following 14 months, P&As remained on the front lines, advocating for students' right to an education, fighting for better safety protocols for nursing home residents, suing state governments over vaccine distribution, working to reduce prison populations, and calling for more funding for home and community-based services. On the national level, NDRN worked with Congress and both the Trump and Biden administrations to secure funding for P&As to continue our critical work. I want to thank each of you at every P&A for the commitment, dedication, and selflessness you have shown this year. At no time in our history as a network have we been called upon to do so much under difficult circumstances. But we rose to the challenge, and I've never been more proud of the network. To continue our discussion of advocacy during COVID, we will hear first from Alison Barkoff. Alison was sworn into the office as the Principal Deputy Administrator at the Administration on Community Living on January 20th, 2021. And is currently serving as Acting Administrator and Assistant Secretary for Aging. In this role, she provides executive direction, leadership, guidance, and coordination for ACO programs nationwide and advises the Health and Human Services Secretary on issues affecting individuals with disabilities and older adults. a friend for many years to the P&A system. We are thrilled to have Alison with us today.
Hi, my name is Alison Barkoff, and I'm the Acting Administrator at the Administration for Community Living in the U.S. Department of Health and Human Services. For more than 20 years, I've been privileged to collaborate with the National Disability Rights Network and P&As across the country. Together, we've litigated Olmstead cases, advanced policies around community living, and fought against disability discrimination in all forms. It's a true privilege to continue my work with the P&A networks in my new role at ACL. I want to start by thanking all of you for the work you have done throughout the COVID-19 pandemic. I know firsthand the life-saving work that you've been doing. The P&As have led the way in fighting against discriminatory crisis standards of care that put people with disabilities at the back of the line for life-saving COVID treatment. You found creative approaches, including through virtual monitoring, to continue your important work to prevent abuse and neglect of people in institutional settings. And now you are playing a critical role in vaccine access for people with disabilities. And you've been doing all of this while, like the rest of us, managing through the pandemic itself, balancing family and work responsibilities, and being isolated from coworkers and friends. So thank you. I want to briefly talk about how we at ACL hope to work together with the P&As to advance the priorities of the Biden-Harris administration. Addressing COVID-19 has been the priority for ACL and the administration. I don't have to tell you the many ways people with disabilities have been so devastatingly impacted, from people who are at high risk for infection and death in institutional settings, people who have lost services in the community and being placed at risk of institutionalization, to the barriers that people have faced in accessing the vaccine. Within the first few days of the administration, President Biden put out a national COVID strategy and a set of executive orders that address and put out specific recommendations for addressing so many of the issues facing people with disabilities. ACL has been working across the entire federal government with our partners at CDC, at HHS's Office for Civil Rights, with the COVID-19 Equity Task Force, and with the White House COVID-19 team to ensure that people with disabilities are considered a part of every single policy and all of our government response. And we know that the P&As have had to take on so much during the pandemic without additional resources. That's why we worked so hard, and we were so thrilled to recently get funding from the Centers for Disease Control to provide resources to expand the important vaccine access efforts that you're already doing. We look forward to continuing our work together on ensuring that people with disabilities are not left behind in any way, as we're still in the pandemic and as we start moving forward towards recovery from the pandemic. The second priority I'd like to touch on is around economic recovery, which includes two pieces that are so relevant to the work that the P&As do. As part of President Biden's focus on economic recovery, he's been focusing on the caregiving infrastructure. And that includes looking at how we can expand home and community-based services and address the needs of both formal and informal caregivers and strengthen the direct care workforce. We have an unprecedented opportunity right now to expand home and community-based services. COVID has laid bare the risks of institutions and congregate settings and created a momentum for us to make a once-in-a-lifetime change. Congress recently passed, through the American Rescue Plan, $12.7 billion, the biggest funding since the Affordable Care Act, towards home and community-based services. Money Follows the Person has just been reauthorized for 3 years, and there's so many more activities. The American Jobs Plan proposes $400 billion of new funding towards home and community-based services, and the President's American Families Plan includes a focus on expanding paid and family leave, as well as a number of crucial issues for people with disabilities. At ACL, we are doing and working along with our partners everything we can to quickly move forward new opportunities as Congress passes them. For example, we are working now on strengthening and expanding Money Follows the Person. And this has included working with HUD to identify existing housing resources that is integrated, accessible, affordable housing to match with people transitioning from or at risk of entering institutions. P&As have long played such a crucial role in transitioning people from institutions to the community, and we look forward to our partnership on this and other initiatives. And of course, we will continue our work working with you throughout the P&A network and our partners at CMS as the home and community-based settings rule moves forward with implementation. There's so many parts of expanding HCBS that we really look forward to working with you on. Of course, we can't talk about economic recovery if we're not talking about employment. And NDRN and the P&A network have been such leaders in advancing opportunities for competitive integrated employment. People with disabilities who already had such a low employment rate have disproportionately lost their jobs during the pandemic. And as we focus on getting people back to work, we absolutely must make sure our focus includes workers with disabilities. President Biden has the same priority, and his American Jobs Plan again proposes ending the unfair and discriminatory payment of sub-minimum wages to people with disabilities and expanding supports for competitive integrated employment. This is another area where we at ACL look forward to working with P&As across the country as you're leading efforts in your own states to expand opportunities for people with disabilities to work in real jobs at fair pay. Finally, I want to talk about the priority of equity. From day one, the Biden-Harris administration has centered equity and directed that all federal agencies embed equity into our work. That means centering racial justice, but through an intersectional lens. And the Biden-Harris administration executive order specifically talks about ensuring that people with disabilities are included in our equity focus. For ACL, that means for us looking across all of our programs and all of our networks to identify the barriers that people with disabilities may face due to factors like race, ethnicity, not speaking English as a first language, living in a rural area, or being LGBTQ. Our work is also really important to make sure that all of HHS's equity work, including around health disparities, includes a focus, an intersectional lens that includes people with disabilities. We're really looking forward to hearing from you and learning from the P&A networks. We know you are already doing so much work around equity, and we're hoping that we can use what you're doing to learn, to inform our work, and to lift up the great practices that are happening in the disability community. I'll end with where I started. Thank you. Thank you for your critical and life-saving work over the last year. As we look forward and start moving towards recovery from this pandemic, we need to seize the unprecedented opportunities before us and make sure that the rights of every single person with a disability are respected and secured. I hope you have a great conference, and we and ACL look forward to our collaboration with the P&A network. Thank you.
Our next speakers are Annie Wilson and Elizabeth Zirker. Annie is a self-advocate from California who is joining us to talk about her experiences through the pandemic. Elizabeth is an attorney with Disability Rights California who represented Annie as she fought to access medical care and services.
Hi, my name is Elizabeth Zirker, and I'm a managing attorney with Disability Rights California, focusing on access to home and community-based services and healthcare. I have the pleasure of introducing Annie Wilson, who is a self-advocate from Alameda, California. Annie's going to talk about herself and her experiences during COVID-19. Annie, do you want to start us off?
Yes. Hello, everyone. My name is Angela Wilson. that everyone calls me Annie. I'm going to tell you a little about myself and my experience during COVID-19 lockdown. I was born with a rare form of muscular dystrophy called spinal muscular atrophy. It's similar to ALS. Recently, my muscles get weak over time. My life expectancy was 3 years of age when I was diagnosed at 6 months. Now, approaching 40, I definitely surpassed all the odds thrown at me, and I have overcome numerous obstacles. When I was a child, I always had my mother to advocate for me. She fought many battles to obtain services that I needed as a child to become independent. Those services included regional center, nursing care, and a special care team of doctors. I am now living on my own with 24-hour nursing care that I direct myself. As my mother aged and was facing her own health issues, her ability to advocate for me faded. Now, on my own, I had to navigate the world and fight my own battles. Some were easy, and I felt confident in going to that for myself. Others, I knew I couldn't undertake alone. I know what I deserved, and I knew what was legal, but I didn't have the background or knowledge to represent myself. So many deadlines, appeals, and court hearings. It was at this point in my life when I met Elizabeth.
Annie and I met in 2018 when DRC took on her case to help her get a new treatment for SMA that had been approved for adults, which is called Spinraza. Despite this approval, Annie's Kaiser Medicare plan refused to cover Spinraza, and we went through a lengthy battle with Kaiser, appeals through Medicare, and trying to get Medi-Cal coverage. In the end, Annie decided to enroll in Original Medicare and got her first Spinraza treatment in March of 2020. Annie, do you want to talk about your experiences once COVID-19 began?
One thing I never expected to happen was to need emergency medical attention and be faced with unreasonable and unrealistic hospital policies. Policies that would put my life in jeopardy. October 2020, right in the midst of COVID, I started having severe hip pain. It took me until March 2021 to get in an appointment. This is when I realized things were different, times were different, and the hospital was no longer a safe place for me. After having to fight to get my license in the emergency resort, I was told I need to be admitted to the ICU, and this procedure will need to be done immediately. They then told me my nurses could not go with me into the unit due to COVID hospital guidelines. No negotiations. I explained why I needed my own support person with me to translate, to move me in a particular way I had to do, to help me eat in a particular way I had to eat, to start to me multiple times an hour, to hold for help because I couldn't push the home button. All of these things I needed to live had to be performed by someone who was safe in my needs.
I'm Lisa. I'm a support person for Annie, and I'm here reading what Annie has written. The answer was still no. At this time of the night, I think it was around 3 a.m., I thought about a conversation I had previously with Elizabeth about work she was doing with her colleagues at a state level around hospital visitation policies in California. But it was the middle of the night and I couldn't call her. I had to leave the hospital against medical advice because the doctor on call was not willing to compromise, and neither was I. I got dressed and left the hospital and told myself I'd be okay. I just needed to go home and regroup, and with the help and support of my team behind me, I would try again another day with facts in hand and a better understanding of what I could demand. With only a few hours of sleep, and it now being a decent hour, I could finally call Elizabeth. I needed help. I couldn't fight this battle alone. I was exhausted and in pain. Elizabeth then went over my rights, and we came up with a plan.
Throughout the pandemic, DRC advocated with the California Department of Public Health and other agencies and hospitals to improve and enforce COVID-19 visitation rules for people with disabilities so that support persons could accompany them. Our executive director, Andy Imperato, and my colleagues Will Liner, Nick Levenhagen, Liz Logsden, Kim Pedersen, and others all worked intensely along with our partners at DREDF to come up with self-advocacy packets with sample letters for people to use if they were denied a support person, which we were able to adapt to Annie's situation to give her a letter she could use when she returned to try to receive treatment at Stanford.
Still defeated and extremely anxious, I had no other choice but to try again, this time at a different hospital. My primary care provider had already called ahead and demanded that for my safety, I needed to have one of my nurses with me at all times. She told me the odds were slim and they would allow this to actually happen, and asked me if I wanted to take my chances to go and see what happens. I told her that I had a letter drafted up by my amazing lawyer and I felt confident enough to give it another shot. There really wasn't an option to not try. The previous hospital warned me that if it was septic, I could die, that I was a ticking time bomb. This time I was putting my foot down even harder, or wheels, I should say. The second hospital also put up a fight, tried to deny me a support person once again. After an hour of discussion, calling for a supervisor and sharing all of the documentation that I had from Elizabeth, they finally agreed to allow one support person. They said the reason they were willing to make an exception was because I had 24-hour nursing support at home. I was thrilled and relieved. It's not like I was trying to have a party in radiology while getting a needle jabbed into my hip. I actually needed help from my staff. As the night went on, many of the doctors and nurses thanked my personal nurse for being there to help me. One ER nurse even said they couldn't have done any of this themselves. They didn't know how to move me or use my ventilator, two very important things to be competent in. They often looked at my nurses to translate things I said, important things like my list of medications and my medical history. This was proof that I had needed a support person with me.
The procedure was finally done successfully, and I know you're all wondering the results. The results were negative, and I was allowed to go home and rest. I could finally rest after all of the unnecessary hoops I had to go through. My COVID experience has been a roller coaster of emotions, stress, and constant fear. One of my actions got COVID and had to be hospitalized. Will I have to go through all this turmoil again? Will I be left alone in a hospital to die from something completely un-COVID related, from an accident, as a result of not being understood? I know these facts were extreme, but they were real and they were lied. I'm sure these were also the concerns of many other disabled individuals needing medical attention and COVID. The struggle was real. It was and still is extremely important for every hospital staff member to understand why disabled people need accommodations.
Policies needed to be changed and people needed to be educated. In the end, this was the result that Elizabeth and I were aiming for. Not a lawsuit, but to educate people and make sure this doesn't happen to anyone else. Small wins, but important wins.
After Annie's experiences, Nick Levenhagen and I drafted letters to both Sutter Health and Stanford, informing them that what happened to Annie was unacceptable and violated the ADA and California visitation guidelines, asking them to ensure their staff understand that people with disabilities can have a support person with them, and that they provide a contact number and information for people who were denied that access. Sutter has agreed to do this, providing retraining for staff, as well as reviewing their website policies. We are still waiting on a final response from Stanford. Annie's dedication to improving access to people with disabilities has resulted in just that. I'm so honored and grateful to work with Annie.
And to that, I would like to say what a pleasure it is to have Elizabeth in my life. She has been my biggest advocate when I was faced with medication denials, getting insurance approvals for adaptive equipment, and during the hospital debacle. I am truly grateful for DIC and the work they do on a regular basis. Everybody needs an Elizabeth Zirker in their life, and I am forever grateful.
Each year, the National Disability Rights Network honors P&As and their clients who have demonstrated outstanding leadership and effectiveness in the fight for the rights of people with disabilities with the annual NDRN Advocacy Award. This year, it is my privilege to announce our first NDRN Advocacy Award goes to the agency where I started my career within the protection and advocacy system, Disability Rights Michigan. When Congress passed the Strengthening Protections for Social Security Beneficiaries, it recognized the critical role P&As have played for more than 40 years in keeping our nation's most vulnerable citizens safe from abuse and neglect. We're so happy to recognize Disability Rights Michigan for its work conducting investigations and monitoring through the new Representative Payee Oversight Program. Despite the many obstacles that the pandemic has created over the past year, Michigan has aggressively pursued reviews and oversight of representative payees in every part of the state. The P&A has shown extraordinary leadership and set an example for all of us in the network. Congratulations to everyone at Disability Rights Michigan. Here to accept the award on behalf of Disability Rights Michigan is my friend and Executive Director, Michelle Roberts.
Hi, my name's Michelle Roberts, and I'm the Executive Director at Disability Rights Michigan. I'm so pleased and honored to accept this Advocacy Award given in recognition of our work on behalf of Social Security beneficiaries who have representative payees. Just like all of you, we were forced to adjust everything about how we do our work as a result of the COVID-19 pandemic that started in March of 2020. It has changed how and when we work and changed what we work on. One of the programs we saw impacted the most was our representative payee program, with very little remaining the way that it had been done prior to the pandemic. Visits and record reviews are being done virtually, and interviews are all done by telephone. And while the specialists would prefer to be in the field conducting interviews face-to-face and putting eyes on beneficiaries and seeing where they live, they've adapted to doing their work in this new way. Initially, when the work was on hold, they used that time to do outreach and to practice and perfect their review skills. So when the time came to get busy, they were ready to go and they were unstoppable. They were so focused on getting their work done and reaching as many beneficiaries as possible. They quickly got into a rhythm for the remote style reviews, and each time that they found concerns, that made them even more determined to work on behalf of the beneficiaries. On behalf of Disability Rights Michigan, I want to thank Curt and all of the staff at NDRN who worked to get this program back into the P&As where it belongs, and for the ongoing training and support that you provide to all of us. I also want to take a moment to hold up each of the staff, former and current, from our rep payee team who each did their part to make the program such a huge success. The program director, Sarah Coronotis, and the specialists, Adam Walker, Amy Coombs, Lori Flemington, Michelle Green, Sandy Peterson, and Sarah Jewell, and the program assistant, Leslie Munt. In preparation to accept this award, I asked the program director, Sarah Coronotis, to send me her thoughts, and this is what she had to say. I'm still so overwhelmed by this recognition for DRM. We have faced numerous hurdles since this program began, and to be recognized after such a challenging year, it's hard for me to put into words how it feels. We love the work that we do, and we want to ensure beneficiaries' needs are being met by their payees. And we also want to assist beneficiaries when we become aware that there are other challenges that they're facing. This program has allowed DRM to interact with so many people, and that is very exciting. So thank you, NDRN, for recognizing the great work that has occurred here in Michigan. We appreciate your support, and we are grateful for this award.
Thank you.
Hello, everyone. I'm Mark Stroh, Executive Director of Disability Rights Washington. It's my pleasure to introduce our next speaker, Senator Patty Murray. Senator Murray is our state senior senator serving for more than 2 decades. She is chair of the Senate Budget Committee and ranking member of the Senate Health, Education, Labor, and Pensions Committee, also known as the HELP Committee. Senator Murray is a tireless advocate for people with disabilities and their families, so please join me in welcoming Senator Murray.
This is Senator Patty Murray, and thank you so much for inviting me to participate in this year's National Disability Rights Network's annual conference. It is an honor to join this passionate community of disability advocates, including so many of you from my home state of Washington. As we work to build back our country stronger and fairer, I know we cannot leave anyone behind, including people with disabilities. That's why I was so proud to include $3 billion for IDEA to continue to meet students with disabilities needs during this pandemic, and $12.7 billion in funding for home and community-based services as part of the American Rescue Plan. And that is why I'm pushing for an historic caregiving investment in the American Jobs Plan. Your voices and stories and leadership are so crucial in our continuing fight to ensure people with disabilities have the care and support they need to live independent lives. And remember, I will always be your partner in the Senate, fighting for equal rights and opportunities for people with disabilities across our country. Together, we can build a more accessible and inclusive country. Thank you.
Next, we will hear from Robin Sue Frohboese, Acting Director and Principal Deputy in the Health and Human Services Office for Civil Rights. During her tenure with OCR, Dr. Frohboese has served in a variety of leadership positions, including Acting OCR Director during 4 administrative transitions. She has been integral to many OCR civil rights initiatives over the years, including the most recent OCR complaints filed by P&As over medical rationing plans that discriminated against people with disabilities.
Thank you, Tom. It's always a highlight for me to be able to participate in NDRN's annual P&A CAP conference. It takes me back to the roots of my involvement in the disability rights movement in the 1970s. And I well remember in 1976, when I was working for the Nebraska DD Council, writing the first federal grant to establish the Nebraska Protection and Advocacy Agency. And the grant was for a whopping $65,000, which was enough to hire an executive director, an assistant, and rent office space and travel. So much, of course, has changed in the 45 years since then. And I've just witnessed with awe and respect the amazing protection and advocacy network across the country that has developed, and also the incredible expansion in the scope of your responsibilities. And joining you this year is a particular highlight for me, because rather than speaking, as I normally do, about OCR's activities during the past year and our planned activities, I'm going to focus on all of the significant things during the past year that have happened because of the collaboration between P&As and OCR. Last year, of course, was the year of COVID, and P&As truly embodied the title of this conference, Leaving No One Behind, Advocacy During COVID, because the pandemic certainly underscored all of the systemic issues of health disparities, including for people with disabilities, and the very real fear that people with disabilities had about being disproportionately impacted and being discriminated against on many levels. The P&As played a pivotal role in bringing these issues to light, and actually in bringing these issues to OCR so that we could help work on solutions. The issues ranged from state crisis standards of care plans, which are plans that set forth decision rules for allocating scarce resources, which were particularly key during the height of COVID, and as well as visitation restrictions for individuals with disabilities while hospitalized. And they also included access to testing and access to vaccinations. The P&As from across the country sprung into action very early on in COVID and filed complaints with OCR, actually beginning back in March of last year. And together we were able to get very speedy relief by a combination of OCR contacting state officials and sometimes having discussions with state officials and the P&As at the table, and other times just helping to open the door to P&As, to give them a stronger platform to work through solutions with states. In all together, we made significant, very quick changes in state crisis standard of care plans in more than half a dozen states, thanks to the efforts of P&As in Alabama, Arizona, North Carolina, Pennsylvania, Tennessee, Texas, and Utah, just to name a few in case I forgot some of you in that list. And I do know that some complaints remain out there and we haven't forgotten you, but we're also focusing on developing a toolkit and model crisis standards of care policies that states can use, because the issues are applicable beyond COVID. And we learned as we continued to hear from you, get your good thoughts, and identification of new issues, that there were stronger and stronger ways to ensure that, that these plans did not leave anyone behind, and to therefore work on a model that embodies all of these good thoughts. We're reaching out to stakeholders and we'll make sure to include the P&As among them. Hospital visitation is another area that you brought to OCR's attention with very compelling stories of the impact on individuals with disabilities who suddenly lost essential people in their lives that they rely on when they were hospitalized. And they were even more terrified and disoriented in already terrifying and disorienting situation, sometimes resulting in chemical and physical restraint and really bad consequences. The stories were so compelling that we videotaped some of the family members and have them on our website, which you can see on our civil rights COVID-19 page that you can easily find at hhs.gov/OCR. And this was another area where, together with the P&As, we were able to bring about significant change. In Connecticut, it was with a state hospital, a state policy, as well as a large hospital. And in the District of Columbia, a hospital system with hospitals throughout the metropolitan DC area. We're still working with a number of P&As on other issues such as testing and vaccinations, most recently in Nebraska and Connecticut. And one thing that struck me as we were receiving these complaints is how the P&As joined with other groups to strengthen the information that you were bringing to us. And I've also seen that collaboration and coordination with other groups and a lot of your policy advocacy work. And so most recently, based on requests that OCR received from disability coalitions, including the P&As, we developed a very comprehensive guidance as well as fact sheet on the critical issues around vaccination and accessibility. And this was also a joint partnership with the Administration on Community Living within HHS, so that we package this practical guidance with a whole compilation of best practices and resources that ACL had identified. Before I close, I did want to turn to areas that I think you are uniquely situated to continue to play a significant role in this administration. And the very first, of course, is equity, which is a major priority of the president and the secretary. And we know that enforcement of civil rights is central to the goal of achieving equality. As part of that, it's also important to see the intersectionality between disability rights and other rights, such as race, sex, and age discrimination. And of course, issues around accessibility also very much impact individuals with limited English proficiency. So just as you joined forces in complaints and some of your policy advocacy work during COVID, all of the work in which the department is engaging on equity is really another good opportunity to reach out to other groups. The second area I wanted to highlight that's also a well-known issue to all of you is the surge in unaccompanied minors at the border, and those children who do end up in HHS custody through our Office of Refugee Resettlement. I know that you've been very involved in these issues in the past as we worked with you over the past several years to make sure that you did get access to residential facilities. And we know from the surge that this issue will continue to be a critical area for P&A involvement. And then a third and final area is just to be on the lookout for rulemaking. And this is rulemaking in both in which our office, the Office for Civil Rights, will be involved, as well as other components within HHS. It's really important that we hear your views because you are the ones with the eyes and ears on the ground, and bringing your perspectives is key. It's interesting that one of the very first briefings that Secretary Becerra asked for when he joined HHS was on disability. And that briefing was one in which all of the agencies within HHS that are involved in disabilities participated. So of course, our office was involved in that briefing. And Secretary Becerra challenged us to think big, to think out of the box, and it really energized all of us at HHS that are working on disability issues. And so I pass on that same challenge to all of you because of just the great work that you have demonstrated to date of bringing the compelling issues to us, and to use this time that you're together for this conference to collaborate with one another, to brainstorm, to talk about issues that you're seeing, to see if they're happening in other states. And so in closing, I just want to say that we've established a great momentum on ways that the Office for Civil Rights can collaborate with P&As. And I look forward to continuing that very important momentum in the days ahead. Thank you.
Last year's presidential election was unusual in many respects, but for some states, it did not end on November 3rd. The attention of the entire country was riveted on Georgia in the days and weeks following the election as state officials counted every vote. Then, with 2 Senate seats up for grabs, which would determine which party controlled the Senate, Georgia became the focus once again as the state held a runoff election in January of this year. Today, we'd like to recognize the Georgia Advocacy Office for their great efforts to ensure people with disabilities were able to exercise their rights to vote in both the general and the runoff elections. Here to accept the award on behalf of Georgia Advocacy Office is tireless advocate Ruby Moore.
Thanks. I'd like to thank NDRN for this award, particularly because I'm well aware of the great work that happens across the P&A network every day. But I also want to thank NDRN for stepping up at just the right time to help us get the candidate forum available in Georgia. You know, they say that it takes a village, and we had a lot of collaborators. This is a great example of what I would call collective impact. building on the longstanding work of Rev Up in Georgia and the Georgia Disability Network, the Self-Advocacy Statewide Network, Uniting for Change, ADAPT, the ARC, the DD Network, the Independent Living Network. We also had CNN, Sign One News. We had lots of folks locally, literally over 100 organizations helped us. And then on the national level, in addition to NDRN, ADAPT, NACDD, the American Association for People with Disabilities, Respectability, and others. So it was a massive effort to kind of be able to address not only getting out the disability vote, making the candidates more aware of the disability community, but also at the same time addressing issues of intersectionality, access to the polls, and voter suppression. So I mostly just wanted to say thank you to everybody who helped make something that could never happen here in Georgia. I'm here with Dana Llyod, who's our PAD director and who also was really our key point person in this broad collaboration this year of getting out the vote in Georgia.
Thanks so much, Ruby, and thanks again, NDRN. It was evident to us early in the election cycle this year that there would be issues of national significance to people with disabilities here in Georgia and across the US. And so we really wanted to kind of reorganize ourselves to think about what could we do? How could we be a part of that process? And Ruby is right. This was not possible without some really, really key collaborations. We started with a series of videos that came from a team meeting where we said, this year there's the ability to be able to vote by mail in lots of different ways, but that just raises so many questions. What if we could answer some of those questions? And right from that moment, we had a series of people who, when we asked, said yes, we will help with that. Starting with our great partners at Uniting for Change, and as Ruby mentioned, Sign One News, who helped us create those videos and make sure that they were accessible to people with ASL interpretation and captioning. And from that point, again, it was just a series of folks being willing to come into this work with us. Notably, the ARC Georgia was key in helping us with the Candidates Forum and a series of work they did with what we called the Vote Grassroots Connectors. So folks in their local neighborhoods reaching out to people to say, what can I do to help you get to the polls? What can I do to help you understand these key issues? What can I do to make sure that you have everything you need to exercise your right to vote this year? And that work continued. It was very exciting when there was a runoff election. We had to pivot to say, how do we answer new questions for folks? How do we get new information out so people are just as informed and just as equipped and just as prepared? The Candidates Forum was an amazing process of pulling together advocates on the ground, as well as organizations to really push those messages forward. That people with disabilities are a part of their communities, are impacted by politics, are involved in elections. And as organizations, we were committed to supporting them to have the information that they needed. Throughout the candidate forum, I think my favorite comment was from someone who said, thank you for making this event so accessible. I feel like I can fully participate. And that was a wonderful moment for us. And then, continuing through the legislative session and paying attention to bills that would make it more difficult for people to vote, and continuing to look for ways to leverage those partnerships and those collaborations that we had nurtured, I won't say built, that we had nurtured throughout the election cycle to continue to offer opportunities for people to make their voices heard. It's been amazing work this year. It's been an amazing opportunity I think so often the work we do can feel incremental, can seem like we are kind of constantly working towards a goal, right? But this year, in some ways, we were able to see those goals realized. And I'm really, really honored to be able to have been such a part of that process. So thank you again to NDRN and the network. We had participation at the Candidates Forum from across the network, so I appreciate everyone who tuned in and shared information, who shared videos, who commented on Facebook posts, because it really increased the reach that we were able to create this year. So I appreciate, again, NDRN and the board and the entire network for your support and for recognizing our work this year. Thanks so much.
And Cheri Mitchell is here, who is our independent living expert and also our HAVA director.
So, you know, and on top of that, we do what we do so well, which is reach out to those people who are the most vulnerable and caught in those places where they're congregated and segregated, and we still reached out to them too, like we always do. And I want to thank Ruby, because if it wasn't for Ruby, we wouldn't be who we are and do what we do. She brings to us a culture that really gets and understands the importance of self-advocacy, of helping people to be the most independent, and understanding how important the right to vote is. So thank you, NDRN, for this award. We didn't forget those people in those state hospitals and in those nursing facilities either. We were out there making sure they got to vote, because they really tried to leave them out. And so, but we wouldn't do what we do and how we do it, though, if it wasn't for Ruby.
So it really was an incredible experience this year of significant collaboration. As Dina said, everyone stepped up, people said yes, and there were really cool relationships that got formed between 90-year-old women who've been driving people to the polls for 50 years and young adapters saying, we're helping this year to get people to the polls as well. And the silver lining here during the pandemic is that this infrastructure, this broad network of people stepping up to address voter suppression and to get out the disability vote is now available to help get out the vaccine and life-saving treatment to people during the pandemic. So thank you again to NDRN.
Our next speaker is Wendy Liu. Wendy is a staff news editor and national reporter at Huffington Post, covering the intersection of disability, politics, and culture. She's written for the New York Times, Teen Vogue, Men's Health, Columbia Journalism Review, and many others. She is a regular speaker on disability representation in the media.
Hi, everyone. Thanks so much to the National Disability Rights Network for having me and for everyone who's tuning in to the conference today. My name is Wendy. I am a Chinese American woman in my 20s. I'm wearing glasses, a trape toque, and a black shirt with flowers on it. In my background, it's just a white wall, and there's a window in the corner as well. I wanted to start out by kind of giving a glimpse into my work, and especially my work as a disabled Chinese journalist. So back in March, when I learned that a gunman had opened fire at multiple Atlanta area spas, my stomach completely dropped. I remember I got the news alert in the evening, and I was thinking, not another shooting. We've been through this over and over. And like I mentioned, I work as a journalist, so I'm a news editor at Post. And unfortunately, I've had to edit more stories than I can count about mass shootings, school shootings, police killings, COVID-19 deaths. And, there's been so much pain already for so many communities. And I was just hoping that maybe in this shooting, I was thinking, hopefully nobody's injured, nobody has died. And that was not the case. And with these shootings in Atlanta in particular, there was another added layer for me personally. It was the fact that when I found out 6 of the 8 people who were killed were Asian women, and that shooter had a sex addiction. And I remember a big question that kept coming up in several days after the shooting was, well, was it racism? Was it sexism? And I was thinking 2 things can be true at once. And, racism and sexism can exist at the same time. They can both be a factor. Similarly, just a few days after the Atlanta shootings, a disabled Asian man found that someone had set his car on fire. So racism and ableism can also exist at the same time. And I know this because I'm a disabled Chinese American woman. And I know from personal experience that racism and ableism can exist at the same time. And despite a lot of conversations that have taken place over the last year, anti-Asian hate is not new. It has existed for decades. It existed when Vincent Chin was beaten and killed in 1982 by 2 white people who blamed him for their lack of work. It existed before 1946, when South Asians and Filipinos were still ineligible for naturalization. It existed before the Chinese Exclusion Act of 1882, which banned all Chinese immigrants from coming to the US because white people were scared that Chinese people were an economic threat. And so these are just a few examples of anti-Asian racism and xenophobia that we rarely talk about and rarely learn about in our school history books, if at all. And it's a type of trauma that we carry with us every day, all the time. And for people like me who are both disabled and Asian or Pacific Islander, the discrimination we face is often interconnected. For example, both Asian immigrants and disabled people often feel like they have to prove that they belong and that they deserve to take up space. And they often feel like they have to assimilate in order to survive, literally, whether it's in predominantly white circles or in inaccessible spaces, or if you're the only disabled Asian woman in the room, as I usually am. And so I thought about all the examples I could give from my childhood, my adulthood, memories of all the horrible racist and ableist and sexist, and sometimes all 3 things that people have said or done toward me, but since I was thinking like, well, I'm here to talk about the intersection of being Asian and disabled, but I decided not to share those examples. And this is why. Because we shouldn't have to relate specific details of our trauma for other people to care about us and to believe us. Because I feel like I'm more than the fear and the pain that I've experienced as a result of hate against my communities. And because I don't want to be called courageous or resilient, because I shouldn't have to be courageous or resilient in order to feel accepted in our society. So instead, I want to share the things that I'm proud of as a disabled Chinese American. For instance, I just contributed to a project at HuffPost called Asian Americans Out Loud, which celebrates Asian Pacific American Heritage Month. I wrote a profile about a disability activist, Alice Wong, who is Chinese American like me, and she talked about what being disabled and Asian mean to her, because it's different for everyone. So that story is something that I'm really proud of, because I love being part of projects that are by and for AAPI people. I'm proud of the fact that I know how to make scallion pancakes from scratch, and I love having them with extra scallions and extra sesame oil, and that I can make them for my family because that makes me feel close to my culture. I'm proud that I've been able to reach people across the world over the last few years who have told me that my writing has made them think a little bit differently about disability and Asian identity. And it means a lot because I feel like I'm making some sort of change, however small, especially in the wake of tragedies like the Atlanta area shootings and the attacks on Asian elders and the deaths of disabled people of color during the pandemic. I think all I ask is that when all of this is over, when the Twitter campaigns have died down and the self-care reminders have dissipated and calendar invites in workspaces to support our Asian colleagues have stopped getting sent, I hope people will still see us and support us and choose to fight alongside us. So thank you very much, and I hope you enjoy the rest of the conference.
Let me add my thanks to our terrific speakers and all of their great words of wisdom to our network. Before we conclude, I want to say a few words about the past year. Since March of 2020, we have been tested in more ways than I thought possible. In fact, in all my years of service with the P&A CAP agencies, the past 14 months have been some of the most difficult we've ever faced. But despite these unprecedented circumstances, you rose to the challenge, as you always do. Your unwavering commitment to serving your communities and protecting the rights of people with disabilities is an example to the entire nation. I want to thank each of you from the bottom of my heart, the hardworking and dedicated P&A and Client Assistance Program staff, board members, and Family Advisory Council members. Over the course of the next 3 weeks, I hope you will take advantage of the many learning and networking opportunities we have planned for you. We at NDRN remain committed to bringing you the exceptional training and technical assistance that you deserve in the virtual environment. Thank you again to all our speakers today, and congratulations to Disability Rights Michigan and the Georgia Advocacy Office. Have a great conference.